Statins are one of the most prescribed prescription drug for lowering cholesterol. Today I'm going to give you some facts about statin drugs that may blow your mind completely. The statins is given for people who has a high cholesterol. To lower the cholesterol, it works on a specific enzyme which is called HMG co-reductase inhibitor enzyme. So there is a enzyme in the liver it works on, and it actually helps to convert your cholesterol. So, but it has lots of side effects, which I will highlight. And the statins are sold for billions of dollars every year. Billions of dollars every year. The most information which is given to the folks that it will reduce your heart attack by 36%. So I'm going to tell you first how they arrived that number 36%. So if you give a statin drug to 100 people and you give 100 people a placebo, so when the placebo is given, which is like a fake medicine, so out of 100, 3 people get heart attack. When the statin is given, 2 people get heart attack. Did you get it? So if you give a placebo to 100 people, 3 people got heart attack. When you give statin, 2 people got. So that means 97 and 98 people did not get heart attack when you were on placebo or on statin drugs. So, but it's 3 versus 2. So that is around 36% reduction. So they reverse it, like out of 100 people, 3 got it, that 1 extra person got heart attack. If people were given statin, then 1 less got. But that's called relative risk reduction. But if you look at the overall picture of it, it's not giving you any bigger protection. And also there are studies available, like if you take a lifelong statin drugs, you are only adding in 3 to 4 days of your life. So like you have to take all your life to add 3 to 4 days, and with lots of slew of side effects. One of the major side effects which you're going to have is a development of type 2 diabetes. There's studies published, many of them, that people who are on statin drugs, they get as high as 56% diabetes after using statin drugs. Diabetes itself is a risk factor for creating heart disease. When people are diabetic, their chances of getting heart attack increases 2 to 4-fold. So you can understand, if you are taking statin drugs, there is the more chances of you getting diabetes, and it also increases the chances of getting heart attack. So that's one. The another major side effect which people get is a muscular fatigue and spasms. And this has been noticed that as high as 60% folks out there who were even former statin users have statin associated muscle symptoms, which is a very common muscle aches and fatigue because of the statin drugs. And that's why 75% people discontinue taking statins, because they are ongoing issues with the muscle fatigue and spasms. So, as I said earlier, that if you want to get better at your heart attack, rather than cutting down small percentage of heart attack, you need to change your lifestyle. Eat more fruits, more vegetables, more whole grains, nuts and seeds, exercise, meditation, yoga, breathing exercise will cut down. And how fast your cholesterol drops? As early as in 2 weeks. 2 weeks. It just only takes 2 weeks to change if you're taking a vegetable-rich diet, whole grains, not refined grains, nuts and seeds. Almost all nuts and seeds lower your cholesterol. Eating more vegetables lower your cholesterol. The more LDL levels you drop by eating this way, your chances of getting a heart attack reduces. And Dr. D. Nornish program has established that people plant-based, the heart disease not only reversed, but it constantly did better. When he put the people on his program, which was again vegetables, whole grains, nuts and seeds, exercise and breathing exercise and yoga, people, they have a lesser heart attack as compared to the people who were on a regular group, and their artery conditions improved over time. Whereas the people who were not taking this kind of nutritional guidelines for themselves, their artery condition got worsened.